Hello everyone, in this presentation I'll be discussing Letermovir, an antiviral agent approved for the prophylaxis of cytomegalovirus disease in CMV seropositive patients following allogeneic hematopoietic stem cell transplantation. Let's dive into how it works and its clinical significance. Letermovir is a 3,4-dihydroquinazolone derivative, making it as the first drug in a new class of antiviral agents. Unlike traditional antiviral agents which target viral DNA polymerase, Letermovir specifically inhibits the CMV terminase complex, a mechanism unique to the virus. This drug is available in two formulations, oral tablets and IV solutions, with typical doses of 240 mg or 480 mg. CMV is a common viral pathogen affecting up to 100% of adults worldwide, and it poses significant risk in immunocompromised individuals and also most common cause of congenital infection affecting 0.5 to 2% of all live-born infants. CMV infections, while generally latent in the majority of the population, can reactivate in immunocompromised patients such as those undergoing allogeneic hematopoietic stem cell transplants. This reactivation can lead to severe complications, making Letermovir an essential component of preventative antiviral therapy. Letermovir demonstrates several important pharmacokinetic properties. After oral administration, it reaches peak plasma concentration in 1.5 to 3 hours. Its bioavailability is around 35%, but co-administration with cyclosporine can significantly increase this to as high as 85%, underscoring the importance of understanding drug interactions. Letermovir has a moderate volume of distribution and is highly protein bound at 98%, primarily binding to albumin in the bloodstream. Tissue distribution, however, is not fully characterized. It is primarily metabolized in the liver through this CYP3A4 enzyme and undergoes glucuronidation via the UGT1A1 and UGT1A3 enzymes, forming a glucuronide metabolite. It is predominantly excreted through the feces of about 93% with minimal renal clearance, making it safe for patients with renal impairment. Its half-life is approximately 10 to 12 hours depending on the route of administration. Letermovir's mechanism is unique. It targets the viral terminase complex composed of UL56, UL89, and UL51. This complex plays a crucial role in processing and packaging of CMV DNA during viral replication. Specifically, letermovir inhibits the cleavage of concatenameric viral DNA into monomeric units that are necessary for the formation of new viral particles. Without this cleavage, CMV is unable to package its genome properly into new capsids, halting the replication process. The advantage of this selectivity is that it bypasses human DNA processing systems, thereby reducing toxicity and side effects typically associated with antiviral therapies that affect human enzymes. Letermovir CMV specific action allows for reduced systemic toxicity, but like all medications, it is not without side effects. Commonly reported adverse effects include nausea, diarrhea, vomiting, and peripheral edema. Patients, particularly those also receiving immunosuppressants such as cyclosporine, must be monitored for potential interactions which could enhance these side effects. Regular blood work is essential to monitor liver function and to adjust doses based on patient tolerance and interactions risks. Letermovir is available strictly by prescription and falls under Schedule 4 prescription-only medicines. The interdisciplinary team plays a crucial role in its administration, especially in transplant settings. Prescribers such as physicians and nurse practitioners must closely monitor patient adherence, potential drug interactions, and side effects. Pharmacists ensure correct dispensing and patient counseling, and transplant teams are integral in routine monitoring to adjust dosages and evaluate drug efficacy. Regular monitoring of liver enzymes levels and possible drug interactions, particularly in patients on concurrent therapies, it is critical to minimize complications. Patient counseling for letermovir involves educating patients about the importance of adhering to their medication regimen to prevent CMV infection. Providers should discuss potential side effects, monitor liver function regularly, provide directions for handling a missed dose, and encourage patients to report any unusual symptoms. Clear communication ensures patients understand their treatment and promotes better health outcomes. Bob, let's test your understanding of Letermovir with some questions.